Hello everyone and welcome to Boundless Dentistry. In this video, we'll talk about Down syndrome. It is an important syndrome that we frequently encounter in our clinical practice and it has some important dental manifestations as well. So in this video, we'll talk about everything that you need to know about Down syndrome, starting from when identifying such patients up to dental management and even systematic management of such patients. So let's get started. Now, Down syndrome is also called as trisomy 21. Now, why is it actually called trisomy 21? Because there is a third copy of chromosome number 21. Normally, there are only two copies of each chromosome. But in cases of Down syndrome, there are three copies of chromosome number 21. Therefore, it's a genetic disorder. And importantly, in this genetic disorder, Down syndrome, we encounter that the patients suffer from physical and intellectual developmental retardation, which we commonly see if we encounter in our normal days life. We see patients suffering from Down syndrome, so we do see that these patients mainly suffer from physical as well as intellectual development as well. But it varies. Some patients suffer more and some patients suffer less. Now, as I've talked before, there is an extra copy of chromosome number 21. So in normal patients, we have 46 chromosomes in total in each cell. However, in cases of Down syndrome, there are 47 chromosomes because there is an extra copy of chromosome number 21. So this is the main thing that you need to know about Down syndrome as to there is an extra copy or third copy of chromosome number 21. Now, if we talk about etiology and pathogenesis of Down syndrome, basically in each normal individual there are only 46 chromosomes which are present, and during meiosis there are like 23 chromosomes from male and 23 chromosomes from female, and then they unite to form 46 chromosomes. But in cases of Down syndrome there is non-disjunction of cell division. What do we mean by that? Basically, when this 46 chromosome they divide, each cell should have 23 and 23 chromosome, so that when two cells they come together they reach the eventual target of 46 chromosomes. But in cases of Down syndrome, what happens is that there is an extra chromosome in one of the cells which leads to 24 chromosomes. So these 24 chromosomes, when they combine with the normal 23 chromosome cell, it leads to eventual 47 chromosome, which basically causes Down syndrome. So this is the thing, this is the main pathogenesis which you should keep in mind, where there is non-disjunction of cell division, which leads to formation of 24 total chromosome cell, which combines with the 23 chromosome, and then it eventually forms 46 chromosomes. So this is the main pathogenesis which you should keep in mind. So this error in cell division is called as non-disjunction, which is the main thing which is happening over here. As I've talked before, during meiosis, one of the pair doesn't divide completely. So one pair has in two copies of the cell, and that two copies lead to 24 chromosome, and that 24 chromosome when combined with 23 forms 47 chromosomes. So one of the cell has 24 chromosome, and then when fertilization occurs, so abnormal amount of chromosome are present in one of the cells, and which eventually leads to Down's syndrome. Now, when we talk about different types of Down syndrome, mainly the most commonly type of Down syndrome that we do encounter is simply trisomy 21, where there is an extra copy of chromosome number 21. Therefore, a total of three copies are present of chromosome number 21. Therefore, patient has a total of 47 chromosome. But in some cases, translocation can also occur where a segment of chromosome 21 attaches to a pair of chromosome. Therefore, there is some segment of chromosome number 21 is present. So, however, chromosome number 46 is still present. The third and a little bit less common is called as moacism, where there is mixture of cells. Some cells have 46 chromosome and some have 47, but this is very rare. The main type of Down syndrome that we do encounter is called as trisomy 21. Now, when we talk about the risk factors which are associated in causing Down syndrome, or you can say leading towards Down syndrome, is mainly the age of the mother. If women who are older than 35 years of age This is the primary factor which can lead to a child which may develop Down syndrome. However, there are other causes which are also associated with Down syndrome, such as mothers who smoke and use oral contraceptives. However, the main, you can say 90 to 95% of the cases are associated with women who are older than 35 years of age. So when they have kids, so that is the main factor which can lead to Down syndrome. Now, moving on towards the different clinical manifestation that we can encounter in our clinical practice, or we see who patients who are suffering from Down syndrome are, first of all, they have short palpebral fissure, as you can see in this diagrammatic picture. They have flat mid-face, or you can say hypoplastic maxilla is present, where the mandible is rotated forward, or you can say moved forward, and the maxilla is present slightly behind. So it may appear that the patient has mandibular Class 3 malocclusion. Other than that, patient experiences short nose, indistinctive, you can say philtrum is present over here, thin upper lip, macronasia, which I've already talked before, that the patient can have either maxilla can be hypoplastic, even mandible at times can be hypoplastic as well. In some patients, we do encounter air abnormalities. These patients suffer ear infection a lot. They have low nasal bridge and epicanthal fold, which you can see over here. They're also present. So these are the main features if you talk about facial features which we can encounter in such patients. Now, if you talk about the general features which we can appreciate in a patient who suffers from Down syndrome, are they mainly suffer from mental retardation, low set ears, they have abundant neck skin, and they have shorter neck as well. Other than that, sometimes they can experience intestinal stenosis as well. Their muscles are very weak, so therefore they suffer from hypotonia. Other than that, they have gaps between their first and second toes, and very rarely, although there is a possibility that these patients are predisposed to suffer from leukemia as well. Sometimes umbilical hernia can also occur, but one of the main findings which we frequently encounter in such patients is congenital heart defect. So this is something that we should always look for in a patient who is suffering from Down syndrome. These patients also suffer from macroglossia, you can say protruded tongue very often. So these are the clinical manifestation and common clinical manifestation which normally we do encounter in a patient who is suffering from Down syndrome. Now, if we talk about complications, so these patients suffer from a lot of complications. Therefore, we should know these complications so that we can take necessary measures in order to prevent such complications. So, we talk about complications. Firstly, up to 90 to 95% of the patients they suffer from mental retardation. So, we have to make sure to offer good mental health support to the patient and provide them a nourishment environment so that they can grow mentally and have good motor skills as well. Now, these patients they suffer from developing late language skills, social skills, and motor skills. So therefore, they need proper therapy so that they can improve upon these skills. They also suffer from growth retardation. These patients are normally short. They don't grow very tall and they have decreased growth throughout their body. So they mainly suffer from growth retardation. Now, an important thing which you should always keep in mind in patients who suffer from Down syndrome is that they do suffer from congenital heart disease. So we should always keep this in mind and perform screening for such patients. Other than that, sometimes these patients can also suffer from respiratory tract infections, sometimes vision problem as well. They can develop cataracts. They can also develop hearing loss, increased risk for dementia, sometimes sleep apnea, and as I've talked before, they have a higher risk for developing acute lymphocytic leukemia. So these are certain complications which can develop in a patient who is suffering from Down syndrome. Therefore, we should keep this complication in mind so that we can treat patients accordingly and therefore prevent such complications to develop in a patient. Now, if we talk about diagnosis, so diagnosis is mainly divided into two parts. Either we are diagnosing the mother who is pregnant before the baby is actually born, and then after the patient has delivered and the baby is born. So there are two types of diagnosis which we mainly do. Firstly, let's talk about before the baby is born and the mother is pregnant. So what we do is that we should offer screening for such pregnant women regardless of the age so that such genetic testing can occur and therefore the patient parents are there prepared whether the patient might be suffering from Down syndrome. So this is something important. So How can we do screening? Firstly, we can go for chorionic villus sampling, where a sample of placenta is taken at the 8th to 12th week of pregnancy, where a sample is taken and that sample undergoes testing, genetic testing, and then it gives us a diagnosis whether the patient is suffering from genetic disorder, any kind of, including Down syndrome as well. Now, amniocentesis is a way where a sample of amniotic fluid is taken at around 12 to 20 weeks of pregnancy, and that also gives us an idea whether the patient is suffering from any kind of genetic disorder, including Down's syndrome. Now, another less frequently performed diagnostic measure is percutaneous umbilical blood sampling (PUBS), where blood is taken from umbilical cord, which is normally performed after 20 weeks. So mainly we go for chorionic villus sampling and amniocentesis, and that gives us an idea whether the baby who will be born might be suffering from genetic disorder or not, including Down's syndrome. Now, after the baby has been born, if you're suspecting Down syndrome, it can go on, the baby can undergo karyotyping in order to confirm the diagnosis. So this is how you'll perform entire diagnostic measures in order to diagnose whether the baby who is born or about to be born might be suffering from Down syndrome or not. Now, let's first talk about the general treatment which is offered to the patient who suffer from Down syndrome before we talk about the dental treatment. So, the main thing which you should keep in mind is that Down syndrome cannot be cured, however, it is treated. Now, how do we do that? Basically, we treat the individual concerns of the patient which is present. For example, they have any masticatory problems, they have any speech problem, if they're suffering from any social skills, motor skills. So, that's the individual thing that we treat for the patient who suffers from Down syndrome. However, one thing we should keep in mind, if the patient is suffering from any congenital heart or GI disorder, so that timely surgery should be performed in order to prevent any serious complications. Now, screening and treatment should be done almost whenever the patient visits a doctor for any vision problems. For example, patient is suffering from cataracts, any hearing loss, in hearing infections, and infections throughout the body. So, screening and treatment should be done for patients who suffer from Down syndrome. Now, if we talk about dental treatment in patients who suffer from Down syndrome, the main thing which occurs in these patients is called periodontitis. So that is the main thing which eventually leads to tooth loss if proper treatment is not offered. So the main goal which we should keep in mind for such patients, because they are a little bit mentally not that well, because and that's why they cannot manage their oral hygiene very optimally. So our main goal is that maintenance of good oral hygiene. Now, how do we do that? Initially, during the early years of age, regular dental visits should be planned so that early onwards patients get used to a dentist and proper taking care of the oral hygiene can occur. Now, you should also be aware that these patients will be, and even normal patients suffer from dental anxiety. So you should know how to manage that now. Since these patients they cannot manage their oral hygiene that well and that it can lead to dental caries, so sometimes topical and systematic fluoride therapy are very beneficial in order to prevent dental caries. Further, to limit dental caries, what we can do is that we can limit the sugar intake of such patient in order to decrease the incidence of dental caries. Now, other than that, brushing should be introduced and helped to such patients so that it can prevent gingivitis and periodontitis. Now, sometimes patients, if they are very well developed and they have such motor skills and mental skills, that they do complain that they have gaps in the teeth. So how do we manage that? We can offer braces to such patients, such as you can see in this clinical picture, there are spaces. So in such patients, we can offer braces so that their spaces can get closed. So this is the general treatment, dental treatment of patients who are suffering from periodont in patients who are suffering from Down's syndrome. Now, lastly, talking about prevention and education of Down syndrome, basically, there is no such way in which we can prevent Down syndrome. However, there are also no direct causative factor associated for Down syndrome. But what we can do to offer them genetic screening so that they can be aware whether their child who will be born might be suffering from genetic disorder any kind or Down's syndrome. So that is one way which we can do. Other than that, also advise parents of Down syndrome children for undergoing regular visitation to the doctor in order to make sure that the child's health is going well. Now, there are certain early key intervention which you should keep in mind so that the child develops well. What are they? Physical therapy so that their motor skills develops well. Other than that, since these patients do suffer from speech disorders, they have difficulty in speaking, so speech therapy is very useful for such patients. Other than that, some occupation therapy can also be offered so that they do be a little bit independent and they can perform tasks themselves. And lastly, special education programs should be offered to the children as well as parents so that they can be more aware of what actually is Down syndrome and how they can actually manage such a condition. So, in this video, we talked about everything that you need to know about Down syndrome, starting off with introduction, the clinical manifestations, diagnosis, etiology, pathogenesis, complications, general treatment, dental treatment, and then finally we talked about how do we prevent and educate parents as well as children suffering from Down syndrome. So I hope this video was useful for you, and if you like this video, please like, share, subscribe, and press the bell icon. Thank you for watching this video. See you next time.